Do you struggle with aching, heavy, or swollen legs? Maybe you're looking for ways to boost your mobility or get your strength back so you can keep up with an active lifestyle. Today, I'm going to talk about 6 nutrients every senior needs to keep legs strong and pain-free. But first, let me introduce myself. I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is created to help answer some of your medical questions and the questions that are commonly asked by patients. If you find this video helpful, please subscribe. As always, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. The first nutrient that seniors need is vitamin D. As we age, many of us become less active. We may not spend as much time outside, and our bodies start to make less vitamin D when exposed to sunlight. This is because our skin becomes thicker, and our skin makes less cholesterol, which is what the body uses to make vitamin D. Vitamin D is important in helping the body absorb calcium. It also helps with muscle function. Studies have shown that people who have low levels of vitamin D are more likely to fall and break a bone. Low vitamin D levels have also been linked to depression and cognitive decline. It's recommended that most adults over the age of 60 get at least 800 to 1,000 milligrams of vitamin D daily. Food sources that contain vitamin D include fatty fish like salmon, tuna, and mackerel, as well as foods that are fortified with vitamin D such as milk and orange juice. However, getting enough vitamin D from food alone may be difficult, and many people may need to take a supplement to meet their daily requirements. For safety, it's best to keep your vitamin D intake within the recommended limits. Too much vitamin D can lead to a buildup of calcium in the blood, which can cause problems like kidney stones and high blood pressure. No, 2 is calcium. As mentioned earlier, vitamin D helps the body absorb calcium, which is important for maintaining strong bones and preventing osteoporosis. Calcium also plays a role in muscle function. Seniors who don't get enough calcium in their diet may be more likely to experience muscle cramps or weakness. Additionally, low calcium levels can interfere with the normal rhythm of the heart, leading to abnormal heartbeats and other cardiovascular problems. The recommended daily intake of calcium for women over the age of 50 and men over the age of 70 is 1,200 milligrams per day. Good sources of calcium include dairy products such as yogurt, cheese, and milk, as well as fortified foods like orange juice and cereal. In addition to diet, seniors can also get calcium through supplements. However, it's important not to take too much calcium, as it can cause problems like kidney stones and high blood pressure. Also, the type of calcium supplement matters. Most calcium supplements contain calcium carbonate, which is poorly absorbed by the body. That's why it's important to choose a supplement that contains a different form of calcium. It's like calcium citrate, which is more easily absorbed. The third nutrient every senior needs is potassium. Potassium is an essential mineral that plays a key role in maintaining proper fluid balance in the body. As we age, our bodies may become less efficient at regulating fluid levels, which can lead to water retention and swelling in the legs and ankles. Drinking fluids containing potassium, such as coconut water, can help counterbalance the effects of sodium and promote healthy fluid balance. In addition to its role in fluid balance, potassium is also crucial for maintaining healthy blood pressure levels. High blood pressure is a common problem for seniors, and studies have shown that people with higher potassium intakes have a lower risk of developing hypertension. By including potassium-rich foods in your diet, such as bananas, sweet potatoes, and spinach, you can support healthy blood pressure levels and reduce your risk of cardiovascular disease. Finally, potassium plays an important role in maintaining healthy muscle function. Muscle weakness and cramps are common complaints among seniors, and research has shown that adequate potassium intake is essential for preventing these issues. By ensuring you get enough potassium in your diet, you can help maintain strong and healthy muscles in your legs and throughout the rest of your body. 4 is omega-3 fatty acids. These are found in foods like fish, flax seeds, and chia seeds. Omega-3s have anti-inflammatory properties, which can help relieve joint pain and stiffness, particularly in conditions like osteoarthritis. They've also been shown to improve overall mobility and flexibility, making it easier to move around and perform daily activities. In addition, omega-3 can help improve balance control, which is important for preventing falls in older adults. Several studies have shown that people with low levels of omega-3 south in their blood are more likely to fall and sustain injuries. By increasing your intake of omega-3 south, you may be able to improve your balance and reduce your risk of falling. Omega-3 fatty acids also play a role in maintaining healthy blood pressure levels. As we age, our risk of developing cardiovascular disease increases, and high blood pressure is a major risk factor for heart disease and stroke. Several studies have shown that people who consume more omega-3 south have a lower risk of developing high blood pressure. By incorporating omega-3 rich foods into your diet, you may be able to help keep your blood pressure under control and reduce your risk of cardiovascular disease. No. 5 is protein. Protein is an essential nutrient that plays a vital role in maintaining strong and healthy muscles. As we age, we lose muscle mass and strength, and this can lead to decreased mobility and an increased risk of falls. Getting enough protein in your diet can help you maintain your muscle mass and strength, making it easier to move around and perform daily activities. In addition to its role in maintaining muscle mass, protein is also important for wound healing and immune function. As we age, our immune systems become weaker, and this can make us more susceptible to infections and illnesses. Getting enough protein in your diet can help support a healthy immune system and reduce your risk of getting sick. The recommended daily intake of protein for adults over the age of 6'5" is 0.8 grams per kilogram of body weight. This can be met by eating a variety of protein-rich foods, including meat, poultry, fish, beans, lentils, and tofu. You may also want to consider taking a protein supplement, especially if you have difficulty meeting your daily requirements through diet alone. When choosing a protein supplement, it's important to select one that is high quality and easy to digest. Whey protein is a good option, as it is easily absorbed by the body and contains all the essential amino acids. And last but certainly not least, 6 is fiber. Adequate fiber intake is essential for maintaining healthy digestion and preventing constipation, which is a common issue among older adults. Fiber adds bulk to the stool and helps it move through the digestive tract, preventing backups and promoting regularity. A diet rich in fiber has also been shown to help maintain a healthy weight, which is important for overall health and mobility. Several studies have shown that people who consume more fiber have a lower risk of developing heart disease and stroke. This is because fiber can help lower cholesterol levels, which is a risk factor for cardiovascular disease. In addition to its role in preventing chronic diseases, fiber is also important for maintaining healthy blood sugar levels. As we age, our bodies may become less efficient at regulating blood sugar, and this can lead to an increased risk of developing type 2 diabetes. By consuming foods that are high in fiber, such as fruits, vegetables, and whole grains, you can help your body regulate blood sugar levels more effectively and reduce your risk of developing diabetes. Eating a balanced diet that includes all of the nutrients I've mentioned can help keep your legs strong and healthy as you age. However, it's also important to incorporate regular exercise into your routine. Exercise can help improve circulation, strengthen muscles, and reduce pain and inflammation in the legs. If you're new to exercise, it's important to start slowly and gradually increase the intensity and duration of your workouts. It's also a good idea to work with a qualified personal trainer who can help you develop a safe and effective workout plan that meets your individual needs. Well, I hope you found this video useful. Please remember to like and subscribe, and stay tuned for more health-related videos. Thank you for watching. Stay healthy and take care.